People of Reddit who work in the medical field, what is something you have had to explain to your patients that was super ridiculous and should be common knowledge? To an 84-year-old man with a candle stuck in his rectum, that you don't need to massage your prostate with a candle once a month. A doctor had apparently told him 15 years ago to do this and he had not questioned it since. Firefighter EMT here. Just because you're taking medication for something doesn't mean it's gone away. Here's a real conversation that happens about once or twice per shift at minimum. Me. Do you have any medical history, diseases, sicknesses and/or conditions I should be aware of? Patient. Number. Me. Are you currently taking or supposed to be taking any medications? Patient. Yeah, I'm on. Insert 12 different medications here. Me. I see one of your medications is metformin. Are you a diabetic? Patient. Not anymore. I just told you I take meds for it. Me. Sigh. I had to explain to my 75-year-old grandmother that there isn't one straight tube connecting your ears. She put eardrops in and put cotton in her other ear before she lay down so it wouldn't leak out. Those instructions must have gone in one ear and out the other. Having to explain that I can't figure out what is wrong with them over the phone. My mom called me and asked me what the rash on her elbow was. After 5 minutes of trying to explain that I needed to see the rash, I finally asked her what she thought of the shirt I was wearing. It took her a couple of seconds to figure it out. That's a good way to put it. I work in IT and people try to get me to diagnose their ailing computers long distance all the time. Sometimes it's possible, but for other problems where I actually need to look at it, I'll try this trick. You're more likely to die from a dental abscess than dental's raise. Doctor, Oz is full of crap. I also hate it when people say, well, if they are so safe, why do you step out of the room, and they act like they freaking stumped me. The reason I step out of the room when taking Zraze is because I do that almost every day. You get it once every 3 years. I don't know if this is a good analogy, but you equate it to a bartender asked to share a drink with his customer. You can have a drink every once in a while, but if the bartender has a drink with every customer, he'd be very sick. Overweight lady with some liver damage. Had many conversations about diet and reducing alcohol intake. Patient had cut out whiskey and vodka, but did not know that Guinness had alcohol. Yes, this was in rural Ireland. My personal favorites are when the families of a loved one bring in food that is completely counter to their current medical condition. Off the top of my head, I have had a family bring in a get well cake to their dad who was on his 5th or 6th admission for DKA, diabetic ketoacidosis. He was still on an insulin infusion and the family didn't seem to see the program with giving him a cake because he woke up and was hungry. I've had families order in pizza to have a pizza party when their parent is admitted on the cardiology ward and on a salt and fluid restricted diet due to extensive heart failure. Good times. Medical professional here. Have many stories that fit the ARP's request. One that sticks in my mind is a patient, 15-year-old kid that suffered a traumatic head injury, was in the ICU barely able to speak, obvious cognitive impairments due to the injury, and the family was strictly instructed to refrain from feeding him anything. Nothing by mouth. No water, nothing. The next morning, I get an emergency page from the ICU because the patient is going into respiratory failure. I rush over to see the pulmonologist and nursing staff performing CPR on the kid. The parents are outside the room freaking out. Sadly, the kid didn't make it. Upon the autopsy, they pulled out a pepperoni slice, crust, and green jello from the kid's lungs. It was devastating to tell the kid's parents that they killed him by sneaking him food. The kid's throat muscles were so weakened by the brain injury that most of the food was ending up in his lungs. The parents thought that the medical team wasn't feeding him for yucks. The only way they could convey their love for him at this time was to give him foods he loved. Tragic lesson learned, I hope. Paramedic friend of mine has had to explain to multiple people that diabetes is not something that everyone ends up getting in life. For whom the beatest tolls. When a woman lets her diabetic son eat ridiculous amounts of sugar, then gets him to run around in the yard to burn it all off because I don't like pumping him full of that insulin. That's not how this works, lady. Poor kid. Shadowed a dentist in a rural area where most patients were in poverty. One guy was so confused on why his teeth were rotting. He revealed that his diet consisted of sugar, sugar, and alcohol. The dentist had to explain sugar can lead to enamel loss. The guy said nope, that is a lie. I was in hospital with my girlfriend while the nurse undressed her. The nurse asked if it was alright for me to be in there. She knew we were together, and we said yes with a confused look. She then told us a story of a couple in their 80s who were in, and when she took down the wife's top to check her heartbeat, the husband covered his eyes and ran out of the room while the wife burst into tears. 40+ years of marriage and they had never seen each other naked. Jesus, that's sad. Really freaking sad. Taking a medication twice a day does not mean taking the doses together. One dose now, one dose later, not both doses now. On a side note, don't give your son your sleeping medication, ever. Repeat patient of the STD clinic I work at, isn't there something I can buy, like, over the counter so I don't have to keep coming back in for chlamydia? Me. Condoms? Dirty dong patient. No. Miss, I meant, like, tea or something. Nah, man. Pretty much just condoms. Once had a diabetic patient who told me that his way to control his blood sugars was to put a tablespoon of sugar in his mouth, wait a few seconds for the diabetes to come to his tongue and then bang, a shot of bagasso, a kind of brandy, and that way the diabetes would die because of the alcohol. Had a hard time explaining to him how these things really work. Sounds legit. In nursing school, my labor and delivery teacher was covering contraceptives and demonstrated how to show patients how condoms are used by putting them on our thumb. At the end of it she emphasized, make sure you tell them it doesn't actually go on their thumb, that the way you've put it on a thumb is how it should be placed on a penis. I had a patient that was truly concerned that his cancer was contagious. He wanted to know how to keep his puppy from contracting it. He was literally more concerned about his tiny puppy getting cancer because of him than his own health. I'll never forget the relief and joy I saw in his eyes when I told him he could have all the puppy cuddles he wanted. Oh man, that's super sweet. Dumb as heck, but still, super sweet. Ooh, I have another one. I'm a nurse in general surgery. My patient had a note in her chart not to let her have any cups in the room, which I thought was strange. We've had orders before for other patients saying they weren't allowed to have any metal utensils. The patient loved to swallow spoons and forks, but that's another story. But this was something new. I quickly found out why when I walked into her room for morning report and several cups of urine were sitting on her sink. Apparently she was too lazy to get out of bed to pee, so she had her husband sneak in some more cups to conveniently pee in. No, peeing in a cup is not allowed. This happened multiple times after multiple talks with the patient, hence the order. Yes, all those cupcakes, brownies, and candy your family has been supplying you with this difficult hospital stay for a rotator cuff surgery might be the reason your blood sugar is 450. Patient's daughter, should we get her the sugar-free candy? In my head, I was thinking more of a veggie tray. Well, that wouldn't spike her blood sugar like that candy has been. The catheter in your penis makes it feel like you have to pee, but you don't. It does it for you. No, don't just pull it out. You'll shred your bladder and seriously regret it. You're screaming right now because you're trying to pull out your catheter. Please stop. No, don't throw your pee bag at me. You'll be arrested for assault. Hospital security. A few years ago, I was taking care of a woman from a rural part of our state. She had just been diagnosed with pancreatic cancer and it wasn't looking good. Her husband was kind of keeping her distance from her. As I was doing something in the corner of the room, he came up to me and whispered, "I can still kiss her, right?" I then had to explain to him that cancer is indeed not contagious and he won't catch her cancer. It was kind of heartbreaking. Oh man. 1. Soda has sugar. I had a diabetic man who didn't realize this. I just don't understand how it was even possible to not know this as a grown but adult. He was a completely normal person otherwise, which is why it had me saying WTF. 2. Pouring Lysol on your diabetic foot also won't keep it from getting infected. 3. When we said clear liquids only like jello, water, and popsicles, we did not mean you should convince your mother to blend you some McDonald's burgers and fries so you can drink that through a straw. 4. Unless you've already done it at least once before, Pushing a baby out of your vagina will neither be a pleasant nor quick experience. Had a couple that had been trying to get pregnant for over a year without success. Turns out they had sex once and were waiting. Per our professor, she was counseling a couple and was starting to consider doing fertility tests before it came out that the couple were using condoms every single time. An executive once came in complaining of bumps on her tongue. She was worried they might be cancer. I got to write my favorite encounter note thus far in my career. Complaint. Bumps on tongue. Asymptomatic. Exam. Tastabuds. Assessment. Tastabuds. Plan. Reassure. I'm a medical student and earlier this year I was taking a history from a patient during a bedside tutorial, where a senior doctor takes a group of us to see a patient together. I was speaking to this man about his symptoms, and used the word penis, to which he gave me a confused look. I said it again and he still didn't know what I was talking about. I ended up having to ask him if he had any pain in his dong while peeing, in front of my classmates and my tutor. Keep in mind that this was a guy in his 40s. Same thing happened, but I said urethra so I wasn't surprised when I had to rephrase. I work in MRI. When we tell you to remove all piercings before your scan, we're serious. You can take out your belly button ring before you go inside the tube, or the machine will take it out for you. You'd probably remove it more gently than the machine, though. I don't work in a medical profession, but I do work in another place where terrible diseases run rampant and staff spend every waking moment fighting them off. A school. There was nothing more bizarre than explaining germ theory to a teacher. She honestly didn't believe that such a thing could exist. She sincerely believed that sicknesses were caused by negative energy and bad auras, and asserted that it was fundamentally impossible for something as small as a germ to harm something as large as a human body, if something that small could even be alive in the first place. She spouted off something about how a creature that small would be incapable of living for more than a few seconds, because energy can only get so small. A germ, she did finger quotes, could only hold enough energy to live for 1 or 2 seconds. At most. These are the people educating your kids. Caring for a woman in her 80s, had to explain to her that you don't pee out of your vagina. There is, in fact, another hole. This reminds me of Orange is the New Black. Half an episode was devoted to female prisoners figuring out that they had a vagina and a urethra. I'm a veterinarian and I don't understand owners sometimes. I work at a clinic of a vet who's also a private animal nutritionist, so sometimes we do house calls for special cases. Client Bob's dog isn't eating well and he has no clue why. I go over and ask him to show me his feeding routine for his dog. He fills a bowl with kibble and the dog seems super excited to eat. I crap you not, he then goes over to the fridge, takes out the ketchup and drenches the kibble in ketchup. By this point my jaw is hanging open in shock and I can see that the dog has suddenly lost its enthusiasm for the meal. I ask Bob politely what he's doing and he tells me that his entire family has ketchup on every meal. I then spent the next 15 minutes explaining to him that his dog may not like ketchup on its food. Now the dog eats great. I'm a miracle worker. That just because you take medication that controls your ailments doesn't mean you don't have them anymore. I ask plenty of elderly people if they have any medical history and frequently get no as an answer, only to then look at their med list and find that they are on a dozen medications. Why do you take this blood pressure medication? Oh, because I used to have high blood pressure. Nope, not how it works. That yes, guys can be nurses too. I'm a guy, a nurse. No, I'm not a doctor. Yes, maybe I should have been a doctor instead, or maybe a woman. Paramedic here. Had to tell a 19-year-old that she needed to change her tampon more than once a month. She was in septic shock. BTW. My sister isn't a doctor in Chicago. She once had to explain to a Mormon couple on their wedding night how to have sex. The 19-year-old man had taken his 18-year-old bride into the ER, convinced his wife didn't have a vagina. She had to tell a mother of 4 that giving your children a heavy doses of vodka didn't not kill the bacteria in their bodies when they got colds. She also had to report that obviously, she had a very frightened 23-year-old girl come to the ER very afraid because she had found a growth in her crotch. It was her clit. When my sister was asking her how she had never noticed it before, the girl responded, "My mom told me if I touched my area that the devil would get me." The girl had lived for 23 years without ever touching or seeing her own vagina. I guess when she would wipe she would just blot the outside quickly or something. A female patient came in and told the doctor that she has been bleeding every month down there, thinking it had something to do with the birth of her daughter. Yeah, I can't emphasize enough the importance of sex education. Birth control does not go in the vagina, unless it's a NuvaRing. Then stash that puppy up there like you're saving it for later. Till where unwanted puppies go. 2 things. 1 is take all the medication even if you feel better at day 3. And 2, you do not give your kid the leftover medication from part 1 when he has the same symptoms a week later. My mom used help herself to my prescription stuff when I was a kid, whether it was to take it herself or redistribute it to my siblings if they had similar symptoms. As soon as I was old enough to handle my own medicine, I had to start hiding it, and we fought about my selfishness for the duration of the prescription. Wanting someone to make you a cup of tea is not a good reason to call an ambulance. I once had a pet owner whom I prescribed prednisolone tablets for ear infection. 1 week later I saw the dog and it was no better. I asked the owner if she had been giving the tablets. She said yes, and I asked how she gave the tablets. She promptly put the tablets in the ears of her dog. WTF. My wife is a postpartum nurse, and on more than one occasion she has had to explain that the baby does not come out of your butt unless there's a 4th degree perineal laceration. I work in a hospital. I was getting some history from this lady when she told me she was allergic to epinephrine, that is adrenaline, you know, the stuff in EpiPens that you'll give to people when they have an allergic reaction to stop anaphylaxis reaction. So I asked her what reaction she had the last time she was given epinephrine, and she told me that it made her heart race and she couldn't settle down. Had to explain to her that that means it worked. I had a lady tell me once that EP put her into anaphylaxis. I just stared at her for like 30 seconds in disbelief before asking her what they gave her to treat it. Oh man, I work at a pharmacy and we get crazy questions all the time. We had gotten a phone call from a seemingly distressed woman asking if we carried a larger sized NuvaRing. My first thought was, holy crap, how big is your vagina? But I realized that there is only one size of NuvaRing. So I told her to come up to our help window and we can try to figure out what the problem was. When she finally came up, I crap you not, this will most likely be one of the funniest things I have ever seen. She comes up, and she is honest to God wearing the NuvaRing as a freaking bracelet. Her actual thought process was if she wore the NuvaRing on her freaking wrist, she could have all the unprotected sex she wanted and be just fine. The look on her face when we told her that it was a vaginal contraceptive. She turned ghost white and gave a meek thank you and hauled butt out of the pharmacy. I felt bad for her, but I could not help myself from laughing. TLDR, read the directions on your prescription. My cousin-in-law is a physician. She had to explain to a then pregnant woman that her NuvaRing had failed because she was not in fact supposed to chew it up and swallow it. A pharmacy student told me this amusing knee slipper. A patient asked her if she could take 2 vitamin B6 soft gels because her doc prescribed her vitamin B12. At least she could do math. Taking your medication which was prescribed as 3 times a day meant you took it 3 times a day, not how bloody frequent you felt like it. When the doctor's nurses tell you that it is a very bad idea to leave AMA against medical advice, you should take their advice. Several years ago when I was a phlebot, drew blood, I went to the nursing station so I could grab someone to follow me into the room. The patient was given a clot-busting drug TPA. This stuff makes heparin look like child's play, and I would need to have a nurse hold pressure on the puncture site for at least 5-10 minutes to see if it had stopped bleeding in that time. The nurse told me stone-faced that they left AMA after that drug. Falling down could cause serious injury because you just don't clot at all. He was back in the OR a short while later. Another lady decided that even though she was in the ICU, that since she got 4 units of blood and felt much better, it'd be okay for her to go ahead and leave. Number. It's not okay. That is stupid. People who think their conditions don't count as medical problems because they're being treated The number of people who say no to the question, do you have any medical problems at all, who then list all the drugs they're on. However, my favorite isn't a genuine ignorance but the way my friend deals with idiots by pretending it's simple ignorance. When taking a history from teenagers, young adults and asking if they're sexually active, yes, and are they using any contraception, no, he lights up and says delightedly, congratulations, you're trying for a baby, it's awesome. They're all like, no, I'm not. Yep, you're having unprotected sex. That's how you try for a baby. Congratulations. No, look, I'm not trying for a baby. You are. That's how you have a baby. Congratulations. I've heard him do it a few times and it absolutely cracks me up. And it gets the message home. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.